Hey and welcome to the EYFDM Podcast, brought to you by the EYFDM Podcast team. This podcast is accompanied by a study on listening behavior. Nadine, what's the study about?
Hey Fabian, I'm always listening to podcasts when I'm on my way to university every day. And I'm sure most of you are listening to podcasts too in your everyday life. But have you ever wondered how different podcasts influence your career choices or your personal life?
Well, if you want to find out more about the study, there's a link underneath this podcast in the bio. And now,
have fun with our EYFDM podcast.
Hi and welcome back to the fourth episode of the EYFDM podcast. My name is Fabian and I'm very happy to have a special guest here today at the University of Melbourne at the Department of Primary Care. She's a specialist GP with a vested interest in dermatology, a lecturer, and has actually quite a bit of experience in podcasting. Dr. Anneliese Willems, thank you for being here today.
Thank you. It's a pleasure to be here today.
What a great department you have here. How did you manage to do academia and GP at the same time?
I've been very lucky. I found that as my career has progressed, lots of doors have opened along the way. And as I've started exploring one particular interest or one research project, then doors have opened into other areas. And I actually first got involved with my role here at the university through my old boss. I was involved in general practitioner registrar training, and I'd stepped aside to be involved with other areas of teaching. And then I heard about this role at the university here, and here I am in academia as well.
So have you always thought about becoming a GP in medical school and then becoming an academic, or did that...
So it's funny that you ask that, because I started medical school like many medical students, saying that the only specialty that I knew I didn't want to do was general practice.
Right.
And I wanted to be a pediatrician. And then I wanted to be a surgeon, and then I wanted to be an emergency doctor. But then when I went into my clinical rotations, I discovered how valuable general practice was and actually came to better understand the specialty and what it actually means. We use a phrase in Australia, cradle to womb to tomb medicine. So talking about caring for people at all stages of life and providing that continuity of care. And as I went through my placements, I realised that actually there was a lot going for general practice, and I realised that paediatrics wasn't the right fit for me. And then I realised, having completed research with surgeons, I thought, actually, do I want to be doing this for the rest of my career? I like talking to people. And I also, while I enjoy procedural work, I really enjoy having a lot more dialogue with patients. And then I also realised that as much as I was a bit of an adrenaline junkie and enjoying work in the emergency department, I realised that wasn't quite the right fit for me either. I had a number of opportunities to complete general practice placements. Some of these were throughout my medical degree as a structured part of the medical degree, but I also had an opportunity through a special rural scholarship to have a placement with a procedural GP based in a country town in Victoria, about 90 minutes from Melbourne, which is where we're recording today.
Wow, that's really interesting. Isn't it surprising how many GPs actually end up in general practice who never intended to become GPs? Isn't that something very special about general practice?
That's so true. We had a really funny moment last week where we were running the orientation day for our first year medical students in general practice, and there was 3 of us presenting, and we actually mentioned how all 3 of us had been going, one was planning to become a psychiatrist and one had actually planned to go into obstetrics and gynecology, and somehow all 3 of us, even though we started out in very different directions, found our place in general practice.
Wow.
Yeah.
So if you have to describe your normal week or normal work week, if that exists, what would that be? How do you divide your time?
So I would say that what I enjoy about my work week, and perhaps one of the challenges as well, is that it is very varied, and I've learnt to be a bit of a chameleon in some ways, switching between different environments. I work the equivalent of 4 sessions in general practice, so that's 4 half days across 3 days of the week. I also work at the university for the equivalent of a day a week, and I also, in my free time, I'm completing a number of research projects and other special interests, such as being on podcasts today.
Wow. Sounds like a busy week. How do you make it work for you? Is there a secret ingredient to actually keeping all these different projects alive?
As I've matured, I would say that I've learnt that not every opportunity is a good opportunity. And I've learnt to pick and choose a little bit what I do. And I also have learnt to think about what time saying yes to something will actually involve.
That's quite a hard lesson to learn, isn't it? Like actively saying no or actively saying yes to things
Yes, it's definitely quite a skill. I often use a phrase with my patients, though, in general practice, and I talk about the concept of how I need to put my own oxygen mask on first if I'm going to provide the best care. So, when you're on an aeroplane and they say how to put your own oxygen mask on first.
Before helping others?
Yes, and I say I need my tank to be at a certain level for me to provide the best care for you. So I'm switched on and I'm ready to put everything into practice that we've been discussing.
It's a very good image. So Anneliese, one of the other special interests that you have is dermatology. Is that something very common for GPs in Australia?
Actually, that's a very interesting question because it's a little counterintuitive, but actually it is quite a common area of interest for GPs in Australia. And there's a number of reasons for this, and that is a huge amount of our work in general practice in Australia is around skin. In fact, 16% of consultations in Australia in general practice involve a skin disease component.
Wow, that's actually quite a high number.
Yeah, it is a really high number. And part of that is because we have such a high degree of UV-related skin disease, so skin cancers. In fact, 2/3 of Australians are diagnosed with a skin cancer before the age of 70.
Oh, wow.
And for our population of 26 million, which will soon be 27 million, 15,000 melanomas are diagnosed every year.
Oh, wow. That is actually a massive issue then.
Yes.
How does it work for GPs to diagnose skin cancers in GP practice?
Sure. Well, a lot of patients will walk through the door and show you in a consultation and say, oh, I'm concerned about this, particularly if there's something new. However, there are many consultations where patients will come in and request to have a full skin examination completed.
Is that something you do on a regular basis, screen for skin cancer?
I certainly do.
Yeah.
It depends on the level of interest and also confidence by the general practitioner. Something that's quite interesting in Australia, just coming back to your question from before about whether it's quite uncommon to be a GP with a special interest in skin disease, where I said it's actually not uncommon. Within the Royal Australian College of General Practitioners, there are particular special interest groups, and the largest special interest group is that for dermatology. In Australia, we have about 37,000 full-time equivalent GPs and 3,900 have a particular interest in skin disease.
Wow.
So there are quite a few of us out there.
Is it quite common for you to use dermatoscopes during your consultations?
Very common.
Wow.
And it's so common, in fact, that we've actually just at the university where we're recording today, we've actually just brought in a workshop within our general practice curriculum introducing the medical students to the use of dermoscopy.
Oh, nice.
I know. Part of the reason that we're doing this is we've had feedback from the medical students saying that they're seeing a lot of dermoscopy use within their terms, but they didn't have the background knowledge to really understand what was going on or know what they were even seeing through the dermatoscope.
I think Europe is quite divided, especially when it comes to the use of dermoscopy. Germany, for example, we use quite a bit of it, but then other countries, even close, just when you cross the border, might not use it at all, and it might be unheard of, and you'd have to go and see a dermatologist for it. So there's a very different approach to it, I think, and can have a massive value to your patient's health when using it.
Well, it's definitely something that is becoming more commonly used within general practice in Australia. Having said that, there are a number of GPs who don't routinely use dermoscopy. So about 50% of GPs will use it regularly in Australia, but that is increasing.
It sounds like your third special interest, I guess, is medical education then. And you've been quite busy recording podcasts on skin disease, set up a class for medical students to focus on skin disease. So how did you end up in medical education?
How did I end up in medical education? So when I started my general practice training, I started attending workshops which were led by GP medical educators, and there was a specialty rotation associated with that which was called the Registrar Medical Education Rotation. And I'd been really impressed with how our educators were delivering content, and I'm the daughter of two teachers and I'm sure it's in my blood somewhere, and I was just really fascinated with the process behind it. And I thought, oh, that's something I could do. And I'd really like to build skills in that area. So I completed a part-time rotation across a year, and it kind of blossomed my interest from there, and I ended up going on to become a medical educator, and then I became a educator within a not-for-profit organisation in dermatology, and I was kind of the bridge between general practitioners and the dermatology world, which was very rewarding. And then I've ended up also here at the university now in more formal academia teaching.
Wow, interesting.
Yeah, so quite a journey.
What a journey, I was going to say. How did you end up recording your podcast? How did you get into the podcasting business?
So, as with many good stories, it all started with a phone call one day where I was contacted by Associate Professor Alvin Chong, who is the brainchild or the godfather behind the Spot Diagnosis podcast. And he was really interested in having a general practitioner voice on it. He'd been trying to target the podcast towards the GP audience. And he was interested in trying to, I guess, tailor it a little bit more to make it relevant to general practice. And given my background in education, he thought that that would be a particularly good fit. And given my passion for dermatology, it certainly was.
Can you tell us a bit more about this podcast? For
Definitely.
Our audience, they probably haven't heard of it. I guess it's not as commonly used in Europe, but maybe when we recommend it here.
Maybe. So Spot Diagnosis is a podcast which aims to explore in depth particular dermatology areas. So in each episode, we explore a particular area of interest. Some of my favourite episodes have included things like oral mucosal disease, hair loss disorders.
I really like the hair loss disorder one.
Oh, yeah. Do you know, I was actually just discussing this particular podcast episode with a patient today who is a medical student and also wanted to discuss hair loss disorders, and they quite keen to go home and listen to the episode later that day. So we'll see what they say when they come back and see me next week. So we have a particular topic of that episode, and within that it's more of an interview style podcast, and we would invite a particular guest or two in that particular area, most often a dermatologist, but occasionally other specialties such as infectious diseases or, for example, an oral mucosal specialist. And we would get them to come into the studio, and then we would ask them all manner of questions regarding this particular topic of interest and kind of break it down into bite-sized chunks and work out how to apply it to practice.
I found it very useful. So I think from my side, definitely highly recommend listening to the podcast. Just type in Spot Diagnosis on Spotify or wherever you listen to podcasts, and I'm sure you'll find it, and you can have a listen to, I think, 20 or 30 episodes were recorded with you.
I think we're up to about 30 episodes now. Last time I heard we were about 50,000 downloads, but I think my numbers are a little bit outdated there.
Yeah, I'm very impressed with your podcast, so I definitely recommend it. Anneliese, we have a little game that we play in this podcast.
Sure.
And to our listeners, you all probably know it already, but I'll quickly explain it again. We have about 50 word pairs, and the idea is for you to pick and choose them as quickly as you can. So don't think too much about it. We're really looking at what you associate or what you identify most with. It can be very basic pairs like cats or dogs. And if you're unsure, you can always say next or skip. The idea is to only say skip up to 10%, so 50 questions. So 5 questions is where you could say skip or next. Don't think about it too much. Just say what comes to mind first.
It sounds good. I'm
ready?
ready.
All right, let's go. Breakfast or dinner?
Dinner.
Early riser or night owl?
Early.
Remote consult or direct patient contact?
Direct.
Clinic or academic day?
Clinic.
Research paper or seminar series?
Seminar.
Research paper or clinical work?
Research paper.
Clinical work or seminar series?
Seminar series.
Working holiday or holiday work?
Working holiday.
Primary care or family medicine?
Primary care.
Family medicine or general practice?
General practice.
Melbourne Medical School or Monash Medical School?
Monash Medical School. I'm a Monash graduate.
Melbourne or Sydney?
Melbourne.
Coffee or tea?
Coffee.
Melbourne or Sydney coffee culture?
Melbourne.
Bike or car?
Bike.
Car or train?
Train.
Train or plane?
Train.
Urban or rural?
Rural.
Victoria or New South Wales?
Victoria.
Victoria or Queensland?
Victoria.
Indonesia or Australia?
Australia.
Melbourne or Auckland?
Auckland.
Ultraviolet or X-ray radiation?
X-ray.
UVA or UVB?
UVB.
Sunscreen or sun hat?
Sunscreen.
Vitamin D or vitamin C?
Vitamin D.
Vitamin A analgon or vitamin D analgon?
Vitamin D.
Actinic keratosis or seborrheic keratosis?
Seb-K. Seborrheic keratosis.
Sunburn or windburn?
Sunburn.
Sunscreen or sun spray?
Sunscreen.
Spray. UV index 0 or UV index 8?
Definitely 0.
Sunbathing versus sun umbrella?
Sun umbrella.
Winter holiday or summer holiday?
Summer holiday.
Chronic care or acute care?
Chronic.
Morning consult or afternoon consult?
Morning.
Tablet or laptop?
Laptop.
Stethoscope or dermatoscope?
Definitely dermatoscope.
Dermatoscope or ultrasound?
Dermatoscope.
Dermatoscope or ECG?
Dermatoscope.
Podcast or live seminar?
Podcast.
Music or physical exercise?
Exercise.
Swimming or running?
Running.
Paper book or audiobook?
Paper book.
Hiking or wellness holiday?
Hiking.
Barbecue or kitchen cooked?
Barbecue.
Home cooked or takeaway?
Home cooked.
Conference dinner or dinner with friends?
Dinner with friends.
Work-life balance or life-work balance?
Work-life balance.
Wealth or autonomy?
Autonomy.
Autonomy or diversity?
Diversity.
Time off or time on?
Time off.
Perfect. That was at 50. You didn't even say skip once. Well done. Interestingly, why did you pick UV index 0?
Oh, I'm very fair. I burn easily outside. I actually, as an interesting anecdote, in Australia, we have a wonderful phone app called the SunSmart app. And that will tell you what the UV index is at any time of day. And so I will often time my running, which I also mentioned, or going for a walk around when the UV index is 3 or below. For those who are interested in dermatology, I'm a skin type 1, or Fitzpatrick skin type 1.
So very fair.
Yes.
And that's probably also why you picked sunburn. Windburn is probably not a thing that you believe in.
Well, yes, we do get some windburn here, but more in certain parts of Australia, less in Melbourne.
All right. Another thing that was quite interesting, you picked the dermatoscope over every other tool for physical examinations, like a stethoscope. Is that something you'd say comes from your patient encounters? Would you use a dermatoscope more often than a stethoscope?
I definitely use a stethoscope more.
Yeah.
Having said that, I would say my passion for the dermatoscope is more. So I went with passion as opposed to use.
Right. Yeah. One of the other things that you mentioned was autonomy, more important than wealth. Is that something that is important to you when you look at all the different tasks that you do? Academia, teaching, research, podcasting, seeing patients, special interest in dermatology. It's quite a lot that you have on your plate.
Yes, I actually really love the autonomy that can be had in general practice. And I think sometimes people imagine the opposite of autonomy is being team directed or enjoying working in a team. And I actually don't think that those are true opposites. I love working within teams, and I'm very lucky that I get to work in a number of different teams, particularly interdisciplinary teams at the university here. Having said that, it is very nice to be able to work out what times of day I work best. For example, I like to give myself a couple of mornings a week to do my research work because that's when my brain is freshest. I mentioned I was an early riser too, but I also like to have some mornings in general practice. So I do like to mix my work week around, and I love the autonomy in general practice that I can do that. I can structure the career that I want.
It must be quite important to your well-being, I guess, as well.
Definitely, yeah.
When talking about well-being, is there anything that you can recommend to our young and maybe not so young anymore listeners in Europe that helps you to get through your busy work week?
Definitely. We were discussing this just before we were recording. Something that is perhaps a little bit of an unusual fact about myself is I actually have a health condition, endometriosis. And a really interesting part of my journey has been working out how I can do all the things I want to do and be the best version of a doctor that I can be and contribute to the health of my patients, whilst also looking after my own health. And it's definitely been trial and error at some particular times, but I actually think general practice has been really good for me in that I've been able to set up a work week that has a lot of flexibility. And I also am very lucky to have quite a tolerant patient base because occasionally I do have to shift around appointments. And I work within teams at the practices I've been based at who are also flexible as well. And I guess my encouragement for those coming through is to realise that in medicine, we all have our own story. And we were discussing before how we have our kind of professional front to the world. And that has its time and place. But also it's important to embrace that we as doctors are humans as well. And we all have our own story, and your well-being and your needs matter as well. And it's really important to look after your own health needs first. And when you look after yourself, then you can be the best version of a doctor possible.
You told me about an analogy that you actually used with one of your patients recently to explain that phenomenon.
I use this analogy a lot, actually. I talk about putting my own oxygen mask on first.
So it comes from the security briefing on the plane.
Yes,
right?
Yeah. I think this also applies with things like having a hobby alongside medicine, having ways of switching off, making sure that you actually have a holiday now and then. Take the time to reset and also be able to reconnect with who you are as a person and what you can bring to the profession.
Wow, yeah, I think that's a very valid point. I think the image of having an oxygen mask that you actually from time to time might need, even as a doctor, it's a very strong image. I think you need to care for your own needs if you want to give your best for patient care or all your other projects in life, I guess.
That's so true.
So, Anneliese, we're coming close to the end of the podcast. Is there anything that you would like to share with our listeners before we head off and let you go back into your busy workday?
Advice to give. I think something that I've been really pleasantly surprised within the world of general practice is seeing how diverse a specialty it can be. I used to love these books growing up, which were Choose Your Own Adventure, and I think general practice is a little bit like that. Within my team at the university here, I am privileged to work with other GPs who have other really fascinating interest areas, and they do so many different things within that. And I would challenge those listening today to take a step back at times and think about how you can make your career work for you and how you can make it more interesting for yourself. And are there any new opportunities you can explore?
Perfect. Thank you very much, Anneliese. Thank you for taking the time today, and we'll let you get back to your busy work day. Thank you so much for being here today.
Thank you. It's been a pleasure to be here.